Well, welcome everyone. Welcome to Botanical Pain Relief. My name is Kenneth Wright. I am a master herbalist. For those of you who don't know what that is, it is based on a UK system, actually on the Commonwealth. So the United Kingdom, Canada, and a few other places, since we can't learn the clinical levels of herbalism here in the United States due to legal constrictions. That is not the case in the United Kingdom and the Commonwealth. So my education came from Canada. I am a resident and a citizen of the United States. I just ventured to Canada to get my education. Master herbalist, of the three classifications, it's the middle one of herbalists. There's a chartered herbalist, a master herbalist, and then a clinical level herbalist who actually practices and can, in that environment, diagnose you as well as prescribe for you. But a master herbalist is just real close to that. I just don't think that we're allowed here legally to practice in a clinical way, so it's much more difficult, so I did not go for that education. But that is what a master herbalist is. I have about 20 years of experience in herbalism. I have been an interested party for many years prior to that, but I've done formal education and things like that, and then done my master herbalist practice for the last 17 to 20 years. And I'm a business owner, co-owner. Verdigris Market Garden, some of you might be familiar with that, some of you might not be. We do sell, I actually grow and make and sell herbal bath and body products as well as health and wellness support products. I have written 3 books on herbalism and sustainability. So we do have one with us today that if you choose to buy after the class, you can choose to buy with your card or whatever. That is Everyday Herbal, and that is what we're kind of talking about today. I've written one specifically for men and the people that take care of men. It is a herbal and holistic care for men. Since most men don't really take care of themselves very well, it is up to other people to take care of them. And I've written that book in mind for people who do, and then for those that love them. And then the first book that I wrote was on sustainable living, particularly in a city, since that's the life we lead, is Ken's Kitchen Garden. It's available anywhere books are sold and on Amazon. All right, but there are some considerations to consider when using herbal products. I always recommend, and this is also a legal disclaimer, don't sue me because 1, I don't have anything, and 2, it's important to have a consultation with a healthcare provider or practitioner. Didn't say doctor. Healthcare provider, practitioner. Somebody who's legally licensed to practice healthcare here. So it could be a naturopath, it could be a nurse practitioner, it could be a physician, it could be a doctor of osteopathic medicine, it could be any of those things. Wherever you feel comfortable getting your certified medical diagnoses from, that's where you get it from. So always have a consultation, particularly if you are on other medications, have chronic conditions, things like that, and that person is knowledgeable. That's the caveat, is that that person's knowledgeable and willing. Throughout our medical life, my husband is in the back, and my medical life, I have encountered medical practitioners who are not terribly knowledgeable nor comfortable dealing with more natural things. In one in particular, I had a wound care doctor who told me that I absolutely had to stop doing whatever I was doing for him as far as his wound care was. Not because it wasn't working, because it actually was working very well, but because that person did not know what was going on or how that worked or anything else like that. And when I offered to educate them, they said no thank you. But much less politely. Individual variability. Every one of our bodies is different. Every one of our constitutions are different. Every one of our chemical makeups are different. So you are not going to necessarily experience the same benefits or the same problems. Not everything is going to work for you the way it works for somebody else, and vice versa. So understand that because we are unique, there's no one prescribed way of doing things. We've known that for years, but our healthcare system, unfortunately, is very designed to be homogenous. If it works for one person, whoever's that test case, it's going to work for everybody. Quality and safety. The quality and safety of your herbal products are of paramount importance. I know the herbs and the ingredients that go into my products that I make and the products that I use in my house because I grow most of them. We have a very big garden that I grow herbs and vegetables and things like that. We have beehives where we get honey and beeswax and all of the things that I formulate things with. So if you are going to venture into the world of making things for yourself, just be aware of the quality of the things that you're buying, sourcing, or growing. Potential risks. Again, like any medication you take or any prescribed methodology of treatment of any pain or condition, there is safety involved. There are potential risks. Just because it's from a plant doesn't mean it's good for you. I wouldn't say if you have an allergic condition that you should rub yourself with poison ivy. That's a bad idea. You can overdo certain medications. People have gotten real wild about turmeric. They're like, oh, turmeric's the new miracle thing, or whatever it was 5 years ago. You can overdo turmeric in your body. Just be careful. Legal considerations. Regulations regarding the sale and use of herbal remedies. This goes back to quality and safety. Know who you're dealing with. Herbal remedies, herbal supplements, vitamins, and things like that are even available on the commercial market are not regulated and are not analyzed by the Federal Food and Drug Administration. They are not. So if you wanted to, you could make really crazy claims about something that does for you, even though it doesn't. Just be cautious and understand that that's the case. If you find safety in those regulations, then that's where your comfort level is, and nobody should judge you for it. So if you stay within the confines of that, great. If you don't stay within the confines of that and you use more natural things, just know that you are doing that based on what you want to do, not necessarily what the government is telling you. Self-diagnosis and treatment. The information in this class is not intended to diagnose you in any way or prescribe a level of treatment. I cannot do that, and unless you are a physician, legally you are not qualified to do that either. Legally, you are not qualified to do that. Being self-aware of your body, we had this discussion earlier about how you feel, that you are very convinced about a condition, and you might be, and it might be very true, but it is not a legal thing that you can diagnose or treat a condition. And educational resources. I always suggest that while this class is going to be absolutely fascinating and you're going to be riveted, it is not enough to just attend this class or just to read one book. I would suggest that you look for other resources, classes. Make sure that you're constantly educating. Self-diagnoses are great, but they can be dangerous. You can go down a path, and I have this conversation with him all the time about his own self-diagnoses because he's very convinced of things. And I'm like, well, that's great, but that's not medically possible. So magical thinking is not something that we want to do when we deal with our health. Before we can talk about what you do to treat pain, let's talk about what is pain. We're going to be going through a lot of slides on this, so it's very important to understand what pain is, what is causing pain, what are the sensations of pain, and to have some terminology behind it. You don't have to be a doctor, but you are going to be talking to doctors, likely. You're going to be talking to medical professionals, and this is the language that they speak. I don't expect everybody to have all of this, but to be armed with this when you go in and have a conversation with a medical professional versus not having it is going to get you further. All right, so some classifications of pain. By duration is an important thing. Acute pain is right now. It's happening right now. It is something that has a quick onset and sometimes can have a quick conclusion. It's acute. It has a cycle. Even an appendicitis, even if it's an acute situation, it has a endpoint, either rupture, surgery, or whatever. So it is acute, and then it's not. Chronic is something that's significantly more long-lasting. It's persistent. It's long-term. Classifications of pain by underlying cause. Nociceptive pain is caused by damage to body tissue. So something has happened to a part of your body, whether it be a muscle, a tendon, skin, whatever it is, joints, sprained ankle, cut. Visceral pain arises from internal organs. Appendicitis, we talked about it. Kidney stones, which my husband is very familiar with. Cramping, aching. You can have liver pain. You can know that it's coming from your liver pain. That's visceral pain. Neuropathic pain results from damage or dysfunction of the nervous system. So if you have nerve damage, either a deterioration of the nerve from a disease, or a cut, or an abrasion, or something. Or inflammatory. This is usually by infection or injury, or autoimmune. So something has become inflamed. We all know what that is. It's swelling. By location. Is it localized pain, like, ow, I banged my knee, so my knee hurts? If ow, I banged my knee and my hip hurts, not the same. Referred pain, that's what that is. Shoulder pain from a heart attack in certain people, men, not women. Women tend not to have the same symptoms as men when it comes to heart attacks. Radiating pain, pain radiating down a leg due to a pinched nerve, sciatica. That's very much what that is. By sensory qualities, this is an important one. So if you haven't taken notes on this one, this might be a good one to take some notes on if you have questions on it. Sharp or stabbing. Your physician or your healthcare professional will ask you this. What kind of pain is it? Is it sharp or stabbing? Ouch. Sharp, stabbing. Is it dull? Is it aching? So arthritic pain can be because of inflammation in a joint, but it is not a sharp pain, it is a dull, aching, persistent pain. Burning pain. So this is a good classification. Rather than injury, burning pains tend to be because of nerves. It's a nerve response to something. Tingling or numbing, neuropathy. Those of you who have struggled or had chemotherapy or other medications, it can cause neuropathy. Tingling, numbness, cold sensitivity. That's pins and needles. Throbbing, rhythmic, pulsing. By trigger. So a mechanical pain, triggered by physical force or movement. So, ow, my elbow hurts when I move it like this. If I'm not in motion, it doesn't hurt. That's mechanical. Thermal pain comes from exposure to heat or cold. Cold and heat, obviously, but cold on the other side will represent pain to you. So we live in winter, and we're going to have some more winter this week. I live in a place where my face hurts because my face is exposed to cold. Different. Chemical pain. Exposure to chemicals and inflammation of the body from an allergic reaction. That can also be like I'm allergic to everything, so life. I'm allergic to life. But that's your responses to allergies are itching, burning. Your eyes burn when you're allergic, or your nose itches, or whatever it is. If you have some sort of chemical exposure, that can be a burn. So these are important things that as you move into a diagnosis of you experiencing something, then learning what it is, and then learning to treat it. These are important words that you should be familiar with. Psychogenic pain. All right. So pain that is primarily influenced by psychological factors. If anybody here suffers from depression, it's painful. It's not just I'm blue or whatever. True depression can incur pain, can be discomfort. You can be so tired and sore and whatnot from depression that you don't want to get out of bed. It's not necessarily just because your brain is telling you that. You're literally in pain from it. Other than direct physical cause, this type of pain can still be real and very distressing because you don't know where it's coming from. Maybe you've never been diagnosed with depression, but you're having a period of time where you're just tired and you think you're just worn down, but you could be experiencing depression. So these types of classifications help you and your professional, whoever you're working with, to help zero in on a diagnosis. I did talk about this when I was doing the interview for this book when it came out, right up on that time. It is that many people go to the doctor and like they go to the car mechanic and they just open their wallet or their pocketbook and they say, here. They're not taking responsibility for it. They want somebody else to fix their problem. This is not the world of herbalism. The world of herbalism is that you know about things and that you are empowered. That is one thing, if you take nothing else from this class, because you'll have notes to refer to, is that you are empowered to make changes in your life. And what I observe is that most people don't want to. They want to hand it to somebody, and they have an expectation that the doctor, nurse, whomever, is going to fix their problem for them. That's not the way the world works. And then people become very frustrated, and they become apathetic, or they become in a state of inertia because they can't get that person to fix their problem. So they're like, well, all doctors are this, or this doctor is this, or I shop doctors, I do whatever. It's a partnership. You'll get closer to getting a diagnosis, you'll get closer to fixing a problem, or at least treating a problem if this is a partnership with your physician and your medical professional. And if it is not a partnership, I didn't tell you to do this, but find a new one. Psychological symptoms of pain. We've talked about this. Chronic pain. Anybody here, and I'm not going to say, if anybody here is suffering from fibromyalgia, it is a chronic pain, and it is debilitating. And being in pain for so long has a direct effect on your mental well-being. So you start having symptoms, psychological symptoms, that are associated with physical symptoms. Fibromyalgia is very real. And if it's chronic or any type of chronic pain, it can become mentally draining. And so there are psychological components to this. It's very easy for somebody to develop depression, anxiety, and substance use disorders, because when you are in pain, you will do literally almost anything to come out of it and to get out of it. And if you are familiar with addiction and the current opioid crisis that we are continually in, you know that that is true. People will do anything to not be in pain. And many people who are on the street or in hospitals or all of those things, and they're shopping for pain, or they're, whatever they're doing it for a reason. It's not because they're terrible people, it's because they're in pain, and whatever they were doing prior to heroin, meth, whatever it is that they're doing, or opioids, was not giving them what they needed. So, if you are in that care world, or if you are associated with that and you've got family members, just understand and give them a little bit of grace. And here's my favorite. Societal responses to pain. I'm in pain, you're not. All you can have is empathy. But most people don't. If anybody, again, is experiencing fibromyalgia or chronic pain, the world doesn't want to hear about it. They really don't. It's unfortunate. Everybody's got their own lives, but there are societal things to go, those responses. Oh, it's all in your head. Oh, you get up and go to work every day. It can't be that bad. Suck it up. You're a snowflake. You're an X, whatever it is. Or if they need something from you. I know you're in pain, but could you walk my dog? Do whatever. Yeah. So if you are in pain, you tend to have more empathy for other people that are in pain, but a lot of folks just lack it.